as you join us for our delve into Facebook Live again. We're bringing a very good panel to help us understand more and more about COVID-19, this virus that's really changed our lives in the last year. We apologize for the delay. There were some technical difficulties, but hopefully we've got those addressed. I am Dr. Mary Beth Miller. I am going to act as a moderator this evening. You will be able to post questions to the chat section, and we will address all of those after the panel of speakers have completed their talks. So without delay, I'm going to introduce our first speaker. It's Dr. Zachary Gray. He comes to us with a wealth of education and experience in emergency medicine. He completed his doctoral degree at USC School of Medicine. He then did an emergency medicine residency at UCLA. He is board certified in emergency medicine, but has also done a research fellowship also at UCLA. He also has a master's degree in public health. He's been with the emergency physicians at Torrance Memorial since 2004. He is the co-medical director of the emergency department, which he has operated in that capacity since 2014. Please welcome Dr. Gray.
Thank you very much, Dr. Miller, and thank everybody for joining us this evening. I wanted to take some time to try to give you an overview of what the situation is like in Los Angeles and California regarding the coronavirus pandemic, and I want to try to touch on what's changed in terms of treatment and vaccination and what it looks like as far as the spread of the virus looks like both nationwide and in California. And I'd also like to talk a little bit about routine emergency care during the pandemic and how it's still safe to come to the hospital for your more regular emergencies such as heart attack, stroke, broken bones, things that need immediate care. And then I also wanted to talk a little bit about the potential for vaccination and what that might hold and when we might expect that. The current state of the coronavirus pandemic in the United States is probably best captured by this image. If you look, this is a plot of the number of cases, new cases, average daily new cases since the beginning of the pandemic. And you can see it took us about 8 months to reach 100,000 cases. And then it took us one more week, this past week, to reach 150,000 cases per day. And this is nationwide. Some of you might wonder whether or not a change in testing capacity might underlie part of this difference. And I think that if you were to compare the beginning of the year with now, that might partially explain things. But nothing has really changed about our testing capacity since August or September of this past year. And you can see how steep that curve is rising. Many of you will recognize that as exponential growth, and that means that there is just widespread community transmission through multiple areas of the country nationwide. In California in particular, we're doing somewhat better, but I think that's really because we're just starting from a lower point. We had done a better job in keeping things under control in the wake of the second surge over the summer. But you can see the shape of that curve starting toward the end of October into November now does represent a similar type of exponential growth. And you can see that we are already approaching the peak over the summertime, and we've reached that in a much quicker time frame than we did over the summer. So it's very concerning for what that might mean for maintaining some semblance of control over the virus in California. One of the things I wanted to talk to you about is your individual risk and what you can do to try to change that and protect yourself. One of the things you'll notice, and that has been talked about widely, is that the single biggest risk factor for having a bad outcome, such as dying from the coronavirus infection, is age. And I think this chart does a very good job of summarizing that. You can see the difference between the very, very low chance of becoming seriously ill or dying from COVID-19 If you're someone in your 40s, less than 1% chance of death. And if you go up to someone who's in their 80s, in their 9th decade of life, it's around about 15%. These numbers have improved slightly over the past 4 to 6 months just because we've gotten better at treating the infection and we have more tools in the toolkit, as it were. But it still remains the case that people in their 7th, 8th, and 9th decades of life are at much higher risk than people in middle age or young adulthood. Other risk factors, for reasons we don't understand, men tend to do worse than women do. And then many of the chronic diseases that we face, for various reasons, most of which we don't exactly understand yet, also mean that people will have worse outcomes with problems such as chronic heart disease, lung disease, kidney disease, liver disease, cancer. Even something as simple as obesity or hypertension are very strongly correlated with doing worse with this infection. So if you fall into one of those high-risk groups, you should be particularly careful. And it's worth noting that probably 1/3 of Americans would have a risk factor just by virtue of being obese, being heavier than they should be. So it may not seem like many of these apply to a lot of you, but they probably do. As far as what you can do to try to protect yourself, it's been said before, but it bears repeating. Wearing a mask is probably the single most important thing that you can do if you're going to be out and about in public. Masks protect the mask wearer as well as other people in their vicinity. In the beginning, we thought there was a larger benefit to bystanders and that wearing a mask, you were doing a greater service for your fellow man, as it were. But more recent data suggests that the benefit to wearing a mask yourself is not trivial. So we would encourage you doing that. Maintaining physical distancing when you have to be out and about, that 6-foot distance we all talk about. The viral particles that are expelled from someone's mouth or nose when they're ill are affected by gravity just like everything else. So they will settle to the ground or on surfaces. And if you're 6 feet away, that gives them plenty of time to do that so they don't settle on you. Other things are hand washing is very important. We're not exactly sure how long the virus can survive on surfaces, but we do know with other respiratory viruses such as influenza, what's called fomite transmission, where you infect yourself by touching a doorknob and then rubbing your eyes or touching your nose, is a big part of how the virus can be transmitted. So washing your hands with warm water and soap for 20 seconds or using a hand sanitizer that's alcohol-based with at least 60% alcohol and rub it until it's dry is an important way of trying to prevent infection. Other things that you can do is avoiding closed spaces. Areas with poor circulation tend to promote transmission of viral infections like COVID. Likewise, avoid activities where people are yelling or screaming or singing. Just the force with which the saliva or viral particles are being expelled is a big risk factor for transmission. This probably underlies some of the so-called super spreader events where large numbers of people have become infected. It's a sort of sweet spot between not wearing a mask, being indoors, and yelling or singing or so forth. And then finally, time of exposure is important. You're very unlikely to get sick walking by someone in the supermarket. But I would not want to get in the car and take a ride to San Diego with someone who's potentially sick, even if they were wearing a mask, because of the duration of time exposure and the fact that you're in an enclosed environment like an automobile. As far as influenza goes, there have been many parallels drawn between COVID-19 and influenza, and Dr. Cader is actually going to speak after me more specifically about influenza, but there are some reasons why we think this virus is more deadly and more transmissible than influenza is. And it has to do with a number of factors. But first of all, most of us have either had influenza before or been vaccinated for influenza. And many of us are vaccinated over and over again, year in, year out, with various strains. And so we all probably have some latent immunity to influenza after a fashion, which just makes it harder to spread, right? Viruses depend upon a host that's able to catch an infection or to spread it to the next person. And so the extent to which we've been vaccinated tends to interrupt that spread. Plus, we have medicines that can treat influenza, especially early on, that can be taken from home, things like oseltamivir or Tamiflu. So this combination of things probably leads to the fact that influenza is less virulent, although still very important. And it's worth remembering that, 2-3 years ago, we worried about a year when we had 40 or 50,000 influenza deaths, which was a bad influenza year for us. And we're talking about 250,000 COVID-19 deaths this year, and the year's not over yet. So just to put that in perspective, it's much worse than influenza. What else can I say? So what to do if you feel like you're having an emergency. First, we'll talk about if you feel like you might have COVID or influenza or pneumonia, some type of infectious respiratory illness. When you come to the hospital, you will be divided between the potential COVID unit of the emergency department and the non-COVID area. And we are doing this for the protection of all of our patients. We don't want anybody to catch an infection from someone by virtue of coming to the hospital. And to our knowledge, we have yet to have a nosocomial transmission of COVID between patients in the emergency department or in the hospital. And that means there is yet to be a patient that came in with COVID that got someone else who was also coming to the hospital for care ill with COVID. So we're doing a very good job of segregating populations of people along these lines. And then if you do end up in the respiratory area of the emergency department where COVID is a potential diagnosis for you, you're going to be broken down into basically 2 categories. Somebody that has mild to moderate illness, or somebody that has severe illness that might require hospitalization. If you have mild to moderate illness, you may still feel very sick. You may have high fever, a terrible cough, you may feel short of breath, but when we say you have mild to moderate illness, what we mean is that you don't require hospitalization or supportive care. You don't require supplemental oxygen or hydration. You're not delirious. You're able to care for yourself. If you come to the hospital under those circumstances, as it stands right now, you'll very likely get a viral test for COVID-19, in addition to many other viruses, including influenza. We have a single swab that does all of those things. And depending upon how sick you are and what your risk factors are like, you may also have other testing, such as a chest x-ray or blood tests, to allow us to better decide whether or not you're going to be okay going home or not. If you're young and healthy, you're very likely to only get the viral test and be discharged home. Oftentimes, you will be discharged home even before the test results, and we'll call you with the results because we really want to minimize the amount of time you're in the hospital emergency department and exposed to other people or exposing other people. If you're unfortunate enough to have a severe case of COVID-19 and require hospitalization, you can expect to have blood tests as well as the viral test, and chest x-ray, of course, and possibly even other imaging such as CT scan. There are some complications of COVID that won't necessarily show up on a chest x-ray, but are very important to detect, and CT scans can help us with that. If you are hospitalized, we do have treatments available now that we did not have at the beginning of the pandemic, and that's principally responsible for the fact that people are staying in the hospital less in terms of duration of time, and they're getting less ill, fewer numbers of people are requiring admission to the ICU, and far fewer than that are requiring mechanical ventilation or being placed on a ventilator. The principal treatment that's shown success in reducing mortality and reducing death are what are called steroids. You've probably heard of dexamethasone, which was the first steroid to be shown to be effective in reducing death in patients that have respiratory failure because of COVID. These are patients that are severely ill, unable to breathe on their own, and end up on ventilators and so forth. We've also discovered that even before you get that sick, if you are requiring extra oxygen to support you, these medicines can prevent your progression to a more serious state of illness. And so almost everyone that's hospitalized for COVID at this stage is going to be placed on these kind of medications. At Torrance, we're using a medicine called methylprednisolone or Solumedrol, but it's essentially the same as dexamethasone in terms of the way it acts. Other medications you may have heard of, remdesivir is an antiviral medication that has shown a lot of success in reducing duration of illness, and I know our infectious disease experts believe that it also has a morbidity and mortality benefit, although that has not been published yet in large trials. Many people hospitalized with COVID-19 are receiving this treatment. And then there's some other more novel, and I would say probably still experimental treatments. Interferon is an antiviral medication. It's actually an immune stimulant that we've been using for decades in the treatment of viral hepatitis that has shown some efficacy in treating patients with COVID-19. And so on a case-by-case basis, our infectious disease specialists are evaluating patients for that treatment. And we're also using convalescent plasma, which are basically pooled antibodies from people who have survived the infection that are thought to help support and stimulate the immune systems of patients that have the infection in order to help them recover. The data on these are mixed, but there certainly does not appear to be any harm, and I think that there is reason to be optimistic that some combination of these treatments is additionally beneficial. The backbone of treatment, though, is still supportive care, hydration, oxygenation, and if somebody requires it, being placed on a mechanical ventilator to support them. People are asking a lot about vaccines these days. Most of you will know that there have been very positive early results from 2 of the large vaccine trials so far. I think that it's very likely that it will still be a couple of months before we see these deployed. I would not expect the CDC to issue an emergency use authorization before the first of the year. It's just going to take that long for them to conduct the safety trials, the safety studies that are required to ensure that these vaccines don't have side effects. And the time period there is 2 months. They really need to wait for 2 months to make sure that there were no major untoward side effects. The good news is there are over 3 dozen vaccines in phase 1 trials and 2 dozen vaccines in phase 2 and 3 trials. And this is in addition to the 2 that have received such great press recently. So there's a lot of reason to be optimistic, but this does leave us with this period between now and then when we just have to do the bread and butter things of social distancing, wearing a mask, and playing it safe. There's just no substitute for that, unfortunately. And even once the vaccines are rolled out, it is going to be a long time before we can vaccinate the population en masse. So I would expect that 2021 is going to be very similar to 2020 in terms of social distancing and mask use. There will probably be ebbs and flows to the numbers over time, but it's probably going to be a year before we end up in a position where enough people have been vaccinated to have a big impact on community transmission. Initial vaccination is probably going to focus on frontline workers, both healthcare workers and non-healthcare workers, and then probably as a second step, focus on the most vulnerable populations. But it will be a long time before we have enough vaccine to vaccinate the majority of Americans. Finally, I wanted to take a quick minute to talk about non-COVID emergency care. One of the things that was most disturbing in emergency medicine in general, and certainly for us here at Torrance, was that during the height of the initial 2 peaks of the pandemic, we really felt like a lot of people were staying home and not taking their symptoms seriously when it comes to things like chest pain or weakness or bleeding or any of the other emergencies that you can have in the absence of having a coronavirus infection. So we saw less people come to the hospital for heart attack and stroke, other severe infections like sepsis, internal bleeding, a large number of things that people just delayed care for. And we really have no reason to believe that those things weren't taking place. And the grim reality is that even when you account for all of the deaths that are attributable to COVID-19 in 2020, there is an excess death rate that is probably ultimately going to be explained by people not coming in for these kinds of emergent problems. So we expect that the coronavirus toll on mortality in the U.S. will indirectly include these kinds of problems in addition to the people who actually die of COVID-19. And so in summary, emergency care is an emergency. If you feel like you're having a heart attack or a stroke or some other emergency, call 911 or come to the hospital emergency department. If you feel like you're having a new medical problem that's not an emergency, please contact your doctor. just remember, we're doing everything we can to keep you safe when you come to the hospital, so please give us the opportunity to take care of you. And with that, I will defer questions until after, and thank you very much.
Excuse me. Thank you, Dr. Gray. Our next speaker will be Dr. Rumi Cader. He is a board-certified physician in internal medicine. He received his Bachelor of Science in Biology and Business Administration from the University of California at Los Angeles. He earned his medical degree from UCLA and Loyola Stritch School of Medicine. He trained in primary care and internal medicine, where he gained greater exposure to integrative medicine, adolescent health, geriatrics, sports medicine, and men's and women's health. He also holds a master's degree in public health, specializing in epidemiology. He enjoys taking care of his patients' health needs, from simple sprains to treatment of disorders such as hypertension, heart failure, pneumonia, diabetes. His practice style is one of collaboration with his patients, employing preventive measures to help achieve the best possible health outcomes. It is his goal to help his patients achieve an active and healthy lifestyle. Please welcome Dr. Cader.
Thank you, Dr. Miller, for that wonderful introduction, and thank you everyone from home. I appreciate you all checking in with us this evening and spending some time with us to learn a little bit about what's going on in the terms of healthcare, especially with flu and influenza and COVID being around. It's a pleasure to be on stage with Dr. Gelbart and Dr. Gray tonight. And I'm going to talk to you a little bit about influenza, but before I get to that, I want to really emphasize what Dr. Gray just said. That being, if you need to go to the ER, please go to the ER. One problem we've been noticing in primary care in our internal medicine, family medicine offices are, a lot of times we'll see our patients, whether it be on a telehealth visit or physically in clinic, and that patient needs to go to the ER. And when we have that discussion, a lot of the times the patients say, no, I'm not going to go in because I'm going to get COVID. And as Dr. Gray has so eloquently put it, that's not the case. It is very safe to go to the ER, and really important for everyone to get the care they need and not just try and stay at home and live through it. So please, please listen to us and listen to yourselves. When your families tell you you need to go to the ER, please do so. So I'm going to talk to you a little bit about influenza. What is influenza? Flu is a contagious respiratory illness caused by the influenza virus that infects the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. The best way to prevent flu is by getting a flu vaccine. Flu vaccine, we're going to keep talking about that this evening. The flu season, while influenza viruses are detected year-round in the United States, flu viruses are more common in the fall and winter. The exact timing and duration of flu seasons can vary, but activity often begins to increase in October, with it peaking between December and February. Activity can last as long as May, especially in states like California, who tend to get the influenza outbreaks a little bit later than the rest of the country in the East Coast and the Midwest. What are the signs and symptoms of flu? People who are sick often feel the current symptoms that I'm going to talk about: fever or feeling feverish and having chills, cough, sore throat, runny nose, muscle aches, body aches, headaches, fatigue, diarrhea, and vomiting. These are all symptoms of possible flu. How do I know if I have the flu? Your respiratory illness might be the flu if you have the symptoms of fever, cough, sore throat, runny nose, stuffy nose, body aches, headaches, chills, and fatigue, as I mentioned before. Some people might have vomiting and diarrhea. However, patients can have other viruses that can cause these symptoms, so just because you have these symptoms does not mean that it's necessarily influenza. Is it possible to test for flu? Absolutely. When you come into the doctor's office, in our primary care offices, we often have rapid tests for influenza, and in the hospital there are separate tests which are a little bit more accurate for the hospitalized patient. So definitely we can tell if someone has flu. And there's various different tests for that. One question I get asked a lot is, will my healthcare provider test me for influenza if I have flu-like symptoms? Not necessarily. Most people with flu-like symptoms are not tested because the test results usually do not change the way you're treated. Your healthcare provider may diagnose you with flu based on your symptoms and their clinical judgment, or they may choose to use a diagnostic test. If you are tested positive, we do have medications such as Tamiflu, which Dr. Gray talked about a little bit before. These medications are most effective within the first 48 hours of symptoms, so I encourage patients, if you are having symptoms, to see your primary care physician as soon as possible so that treatment can be initiated if necessary. What is the burden of influenza? As Dr. Gray said, COVID is a lot more deadly. The current cases of COVID, 250,000 deaths in the United States as of today, with 11 million people testing positive in the country, and these numbers are going to be higher, unfortunately. Influenza, still, a lot of people think it doesn't kill. Unfortunately, it can. Typically, we have about 30,000 deaths a year from influenza alone. CDC reports from the 2018 to 2019 year showed 34,000 deaths, with 490,000 hospitalizations just for influenza in that same year. How does flu spread? Flu spreads mainly by tiny droplets made when people cough, sneeze, or talk. These droplets can land in the mouths and noses of other people who are nearby. Less commonly, you can get the flu by touching a surface or object which was contaminated with the flu virus on it and then touching your own eyes and mouth, oftentimes the same kind of way that COVID is contracted. Typically, about 8% of the US population gets influenza on a yearly basis. Period of contagiousness. You may be able to spread flu to someone else before you know you are sick, as well as while you are sick. People with flu are most contagious within the first 3 to 4 days after their symptoms start. Some otherwise healthy adults may be able to infect people 1 day prior to symptoms beginning and up to 5 to 7 days after they become sick as well. Some people, especially children and people with weakened immune systems, might be able to infect others for a longer time. The onset of symptoms for influenza, that's the time from when a person is exposed and infected with the flu to when symptoms begin, is about 2 days, but can range from 1 to 4 days. Complications of influenza can include bacterial pneumonia, ear infections, sinus infections, and worsening of chronic medical conditions such as congestive heart failure, asthma, or diabetes. People who are high risk get flu. Anyone can get flu, even healthy people, and serious problems related to flu can happen at any age, but some people are at a higher risk of developing serious flu-related complications. This includes people of age 65 and older, and patients with certain chronic medical conditions such as asthma, diabetes, or heart disease, pregnant women, and children younger than 5 years. Other than the children under 5 years, these are the same risk factors high-risk patients would be for COVID as well. Preventing seasonal flu. The first and most important step in preventing influenza is to get a flu shot every year. Flu vaccination has been shown to reduce flu-related illness and the risk of serious flu complications that can result in hospitalization or even death. The CDC also recommends everyday preventive actions like staying away from people who are sick, covering coughs and sneezes, and frequent hand washing to help slow the germs that can cause the respiratory illness. Timing of vaccination, the CDC's current recommendation is optimal vaccination. Timing would be October. We're already in November, so I highly encourage everyone to go out and get their influenza vaccine. I'm happy to say that the majority of patients I'm seeing in clinic have actually already got their influenza vaccine, either from the local pharmacy or in clinic with us. One thing we really want to emphasize this year is with COVID being around, we really want to avoid the possibility of people who are getting both influenza virus and COVID virus infection at the same time. I have seen a couple of cases of those in early March. of this year when COVID first started coming around, and we really don't want to have people with two potentially deadly illnesses having two viruses circulating in their body. So one thing we can really do to help prevent that from happening is at least to have the flu shot so that one of the viruses can have minimal effect on us. So please, if there's one thing I can't emphasize more, is seek care from your doctors for your primary care issues. If you need to go to the emergency room, go to the emergency room. Please wear a mask as much as possible, socially distance as much as possible in order to prevent COVID, which will automatically help prevent spread of influenza as well. We do have the vaccine for influenza at this time, so please go out and get it. COVID vaccine, we're all hoping we get it sooner rather than later, and the great news with the Pfizer and Moderna vaccination trials, looks like we have a pretty good vaccine on hand, and the next step is going to be to get it distributed throughout the country. Thank you everyone for listening tonight, and I'll save questions for a little bit later.
Thank you, Dr. Cader. Our next speaker is Gelbart, Ph.D. He is a licensed clinical psychologist and a graduate of the University of Southern California. He's been practicing since 1976. As executive director and one of the founders of the Thelma McMillen Recovery Center, he has expertise in alcohol and substance abuse and is certified by the American Psychological Association in the treatment of substance abuse. Dr. Gelbart has wide experience in workplace violence and stress, managed care issues, chronic pain, and works with adolescents and adults in individual and couple and group therapy. In addition, he treats anxiety, depressive disorders, and relationships. Recently, he's taken on the role of Director of Behavioral Health at Torrance Memorial Hospital. He is using his expertise to better serve the community in improving mental health awareness and services. I want to personally thank Dr. Gelbart for coming tonight. In addition to all of the fears we've had about the physical illness of COVID, there has been a spike in behavioral health symptoms in all age groups. Anxiety and depression are something I'm seeing every day in clinic and something that most of us have experienced ourselves. So I'm looking forward to what Dr. Gelbart can help us understand more about how we deal with this virus.
Good evening. Thank you for attending. I really appreciate you taking your valuable time. Thank you to the hospital and the entire staff for including me and on such a distinguished panel. I'll be talking about something a little bit different, which is holidays and the pandemic, handling your emotions. So as we've heard already, these are difficult times. We all know that. And our physical health is at risk, and as Dr. Miller said, our mental health is at risk as well. We have the highest rates of anxiety, depression, suicidal ideation, substance abuse that we've had in probably forever. The self-help call lines are about 400% increase in their volume. The therapists and psychiatrists in this community are continually and constantly booked, and so people are experiencing a great deal of stress and anxiety. And then on top of that, we're coming into the holidays, and we have Thanksgiving right around the corner next week, Christmas holidays right after that, and holidays mean families getting together and gathering together and spending time together and doing all those things, the opposite of what Doctors Cader and Gray just told us would be safe ways of being. So, question is, what are some ways to handle how you're feeling about these things? And I just want to make it clear, I'm not here to preach, and I'm not here to tell you what to do. This is really some tips for coping, and we'll all find our way, sort of the way that fits best for us. So first, let's talk about expectations and managing your expectations. As this says, the key to happiness is letting each situation be what it is instead of what you think it should be. And the way I look at it, we have expectations and we have reality. And the space between those two, the bigger the space, the more psychological problems one's going to have. And so we have to learn to deal with our expectations, and especially around the holiday times. You know, this is a Norman Rockwell type holiday photo of Thanksgiving, and everybody's happy and wonderful and together and sitting close by. And, you know, even before COVID, believe it or not, many people suffered during the holiday season, partly due to expectations. You know, a picture like this would be the way we thought it was supposed to be, and yet when we think about our own family situation, maybe it's not quite so pretty. Maybe there's stress, maybe there's fighting, maybe every year Uncle Jack comes and gets drunk. And so, believe, you know, the holidays brought lots of anxiety and stress with it because we needed to manage what our expectations about that was. During COVID times, it's even more so. Many of us are going to have to think about what this is going to look like for us, what this time is going to look like for us. And one thing to do is to focus on the meaning of the holidays. You know, this is a time, it's, as I said, great stress, anxiety, and so on, but it's also a time to potentially thrive rather than survive. It's really been interesting. I've worked with a lot of people who have taken this time and learned how to grow through it. And if we can do that, if we can get growth and as I say, thriving rather than just fear and withdrawing, I think we'll do better. So to begin with, let's focus on what the meaning of the holidays are. As I say here, not fancy meals or gifts. It's really about expressing love, care, and friendship, doing acts of kindness for others, gratitude for what we have, and spending time with loved ones. And in this COVID time, we can find creative and interesting ways to achieve all of these without necessarily getting together. And by the way, I'm going to be speaking in a few moments about, you know, I'm not advocating that you do or don't get together, but what I will advocate is that you make the best choices for yourself, and if you are not around the people you are normally around during these holiday seasons, there are, as I say, things you can do. There are drive-bys, there are Zoom meetings, there are dinners you can share. We can communicate feelings and intentions in writing and in verbally expressing ourselves. So there's many creative ways to make sure that we get to the core meaning of what the holidays are about, rather than worry about sitting down together at a table or spending a couple of hours together, if it's not possible. It's really important, I think, to define your own level of safety. And what's essential is that this is unique to you. I'm a real advocate of, you know, do not judge others for what they choose to do, but more importantly, don't judge yourself. Don't begin saying, I should do this, I should do that, my neighbor, my family member wants me to do such and such, and I should do, you know, get together on Thanksgiving or Christmas meal, even though I don't really feel comfortable. So the issue is, again, don't judge your own thoughts, don't judge your own feelings, and at the same time, don't judge others. When we talk about feelings, it's important to what we call validate your feelings. What somebody feels is always correct. So if you tell somebody, I'm afraid, somebody can't say, no, you're not. What they will try to do is tell you you should not feel that way, which is the opposite of validating. They are invalidating your feelings. But the way to validate feelings is to listen and understand that what a person is feeling is always correct for them based on how they think and based on their experience. And I think it's important to learn to talk to people in a certain way. You know, I've been sharing this motto lately: talk so people will listen, and listen so people will talk. And it's really important to listen, hear, not judge, respect other people's opinions. You don't have to agree, you don't have to have the same opinion, but you can still respect what someone else believes. And with that, of course, we have to learn to express your feelings if we're going to validate people's feelings. So talking about what's inside of you is, again, really important. I want to take a moment just to, you know, as I'm talking about thoughts and feelings, let me give you a little bit of conceptual understanding of how these go together. As I said, your feelings are always correct, but your feelings are based on your thinking. And how you think may be correct, but it may be distorted. It may be a result of your history. It may be a result of insufficient information. But your thinking always determines how you feel. And then your feelings determine how you behave. And what we do when we have difficult kinds of feelings, when we feel sad, for example, or we feel afraid, we can't make ourselves feel differently just by snapping our finger. But what we can do is take a look at our thinking. This is called cognitive behavior therapy, which basically all therapy in my mind is cognitive behavior therapy, because cognitive behavior therapy means we're going to take a look at the way you think and maybe adjust it or change it. And if we change how we think, we suddenly change how we feel. So there's this, as I say, combination and connection between thoughts, behavior, and feelings, and it's important to understand the connection between all three. But mostly what we're trying to achieve is the proverbial sort of glass half empty and glass half full. And as this says, perspective can change the way we look at life. It can be a turning point or it can be a triggering point. And if you look at the glass as half empty, you're going to feel sad, unhappy, depressed. If you look at the glass as half full, you're going to feel a little more joyful, a little more uplifted. And here's the beautiful part about that. The glass does not have to change. The amount of water in the glass doesn't change. All that changes is your attitude and approach to it. And that helps determine how you feel about it. So we are in control on some level of how we feel if we take a look at how we think. And again, I'm going to tie this into what we're really looking at, which is how we're going to do that during this holiday season. Another thing we can do is take an inventory of your strengths. A lot of people are afraid now, a lot of people are anxious, but we're very resilient. And it's really important to look through your own life history and take a look at the struggles and bumps you've had in the roads in your own life and know that you've gotten through all of those and you have a lot more strengths and abilities and resiliency than you may realize when you're actually when you're going through this difficult time. So it's important to take an inventory of your past, your abilities to get through difficult things, and to recognize you have that inside of you, and to not let that fear sort of overwhelm and overcome you in a sense. Another important factor is to live in the present. As this cartoon says, Snoopy says, I think that's Charlie, I don't even remember, but someday we will all die, Snoopy. And Snoopy says, true, but on all the other days we will live, or we will not. So we need to live in the present. We need to learn how to live in the here and now, because the opposite of that is what I call, we live in the what is world, what if world. And I work with people to change really one letter, to go from what if to what is. Because what if is a sense of catastrophizing your life. What we do as people is we say, well, what if I get together with my friends? And what if somebody gets sick? And what if I get sick? And what if I don't get better? And we go through this entire row, and before we know it, we've created a terrible event. Our bodies are reacting to it. Our bodies are stressed out and anxious, and it has not even occurred yet. We call that catastrophizing. So what I ask people to do when they are in the habit of catastrophizing is stop, take a breath, and ask yourself what is. What is in the present. What is in the moment. And I'm going to get to another point in a moment, but when you deal with what is, then you can do something about it. You can control things much better in the present than you can in the future. So this says, if you are depressed, you are living in the past. If you are anxious, you are living in the future. If you are at peace, you are living in the present. So depression is past, anxiety is future, and if we can stay in the present, we have a better chance of dealing with what's going on around us. Which leads us to another staple of how to cope during these difficult times, and that is control the things you can and let go of the things you have no control over. And as you see on this chart, what are the things you cannot control? It's mostly other people's behaviors. You can't control if other people are going to wear masks or not, but you can control whether you are around those people, and you can control whether you wear a mask. You can't control the actions of others. You can't control what's going to happen in the future. You can't control most results. The only things we have control of generally is our own behavior. And again, this becomes, as I say, important during this pandemic time because a lot of people have, we've been in an environment, in a society of difficulty, not only around COVID, but around civil unrest and the election and everything that's going on, and we're not hearing each other very well. And we try to control other people's actions and thoughts, and we wind up getting into very difficult places with that. And so what I'm asking you to do, again, when I work with people, I say take a breath. When you get into a difficult situation, ask yourself, what part of this do I have control over? And if you can do that, all of a sudden you feel empowered, and you feel like you have something that you can manage, rather than worrying constantly about things you do not have control of, which is really the behavior of others. Practice mindfulness, meditation, and relaxation. Any of those. It's basically learning to control your body with the power of your mind. And there are great tools available in this day and age to help you along. For example, there are 2 apps that come to mind, Calm and Headspace, which are available. And I use Calm myself, but they are, you plug into your cell phone and they have meditations for sleeping and for anxiety and for depression and for just general well-being. And what that does is it lets your body come to rest for a moment and regenerate itself. I look at stress and anxiety and worry. It's as if you had a rubber band and you stretched it, then you stretched it again, and you stretch it again. Eventually what's going to happen? It's going to snap. And that's what we do all day with our thinking and our what-if thinking and the stress around us. But if we have the ability to relax, and relax is not kick your feet up and drink a beer and watch a football game. I'm talking about the relaxation that the mind can do over the body. Then that's like taking that rubber band and letting it contract again and come back to the beginning. And then we'll stretch it out again during the day, and then we'll relax. And you can do these kind of mindfulness or relaxation exercises really in 30 seconds. I could do it while I'm standing here and take a deep breath, and my body will be used to just relaxing itself. So it's really important. It's a great skill that everybody should consider. And then finally is gratitude, which is a big part of coping with this pandemic. And that is, there's research that indicates that having the ability to show and experience gratitude in your life correlates with personal happiness and even with personal health. So I ask people each night to say, what are 3 good things that happened to me today? And they don't have to be big things. They could just be things that are positive, and to focus on things that because we spend that what-if time, that worrying time with worrying about what we do not have and what is not going on and what's going to happen. And it's important to take an inventory on a regular daily basis and realize the things that are going on and that we have going for us. And, the final thing is really, as I say, these are difficult times, but this will, if we do all the things that Dr. Gray and Dr. Cader were talking about and take care of ourselves, this time will pass. This too shall pass, as they say, and we will, maybe a new normal, but we'll be back to living our lives in a more normal way, and hopefully the next holiday season will be better emotionally prepared for dealing with than we are during this one. So thank you for your time, and we'll look forward to some questions at the end. Thank you.
So thank you, Dr. Gelbart. You didn't disappoint. And just to tag on to that, maybe next Thanksgiving we can make up for all the things we didn't do this Thanksgiving. So now we are going to start to address all of the questions that have been collected on the chat. So if you are still watching and want to submit questions, there's still plenty of time. So I'm going to just share the question, and then if there's a particular panel member, I may direct it to that panel, or I may just direct it to the entire panel. I ask the panel to chime in with whatever you'd like to add. So I'm going to start with the first question. I have a mammogram scheduled in December. Should I postpone this? I may ask Dr. Cader for his perspective.
Sure, that's a great question, and a lot of our patients are asking us, should they do their preventives during this COVID time, and the answer is absolutely yes. Please get your screening test, whether it be mammogram, a colonoscopy. These are really important to help prevent diseases and catch diseases early if you have it. So my recommendation would be, if you do have something scheduled, please go ahead and do it.
And from the primary care perspective, I want to follow up with Dr. Gray. All of the facilities that are operational have all of their protocols in place, physical therapy, the colonoscopies, any of the treatments that are being done are very, very safe. And I'll challenge you that it's safer to come and do these things than to go to the grocery store or Walmart. How is Torrance preparing for surge? And I'll ask Dr. Gray to start with that one.
Sure. I mean, on the one hand, we never really stopped. We've been segregating patients in the emergency department ever since the pandemic began, and we have staffed up and staffed down and staffed up as needs be. We have added both nursing staff and physician staff in anticipation of the winter surge that seems to be happening. This is a routine practice for us because every year we do have increased volumes related to influenza and other respiratory illnesses. This just happens to be a year where we have a new respiratory illness as well. The hospital has staffed up and has reorganized the inpatient units to be able to support COVID-19 patients, whatever level of care they require. And we have plans on the drawing board to further increase capacity if that becomes necessary. Some of you may remember that we had converted the valet parking lot out front of the main emergency department into an ambulatory treatment area for people with COVID-19, and that stood empty and unused for several months before we took it back down again, as we just never had the need for that. But we have the ability to spool that back up on a very short time frame if that's required. So I think that we have made all of the arrangements that we can possibly make, and we're just waiting to see what happens.
And Dr. Gray, I've heard patients concerned that if they have to go to the ICU, they're going to be in with COVID patients, or if they're in the hospital, they're in with COVID patients. My understanding is there's segregation on all areas, not just the ER?
That's correct. In fact, in the rest of the hospital, from a geographic point of view, the segregation is even more robust because you have whole units that have been just cordoned off for COVID-19 patients. And so we will not have COVID-19 patients on the non-infectious floors. And there are ICUs that are reserved for COVID-19 patients and other ICUs that are non-respiratory or non-COVID-19, and likewise for all the levels of care in the hospital. So, good question.
Dr. Gelbart, any advice on how I can tell my kids I'm not coming to Thanksgiving this year?
Well, yes. I'll say that as a father and grandfather who will not see his kids for Thanksgiving this year. If your children do not, or your family members do not understand, it may be difficult to convince them. But I think the first thing is tell them, talk from a feeling place. Talk from a place that is, not, as I said earlier, judgmental, or not trying to discuss what's right and wrong, but tell them how you feel. Tell them how much you miss being there and how much you'd love to go, and then tell them what your concerns are, and that this will be painful for you, but you're making the best choice you can make for yourself. And again, as I said earlier, there are many ways to express the meaning of the holiday without actually sitting at the table together, and find your ways, those ways inside of yourself to make sure that they understand that. And the best you can do is just do your part. In other words, if it gets through, that's great, and if, just opening up and being as honest as you can about it is the best that you can do with that.
I have a leaky heart valve. Am I at higher risk to get COVID? Dr. Cader, Dr. Gray?
So I can address this. I don't think that you're at higher risk to contract COVID, but you may be at higher risk for complications if you become ill. Anyone with chronic heart disease, valvular heart disease being just one type, is going to be at higher risk if they develop a serious respiratory illness. And so that's how I would answer that question.
I would agree with that completely, and same thing with influenza. You'd be at high risk if you contracted the disease. It does not mean that you are more propense to get the disease, but if you do have it, you could have complications.
Should people have concerns about getting the COVID vaccine? Should we wait?
My recommendation would be, as soon as there is a vaccine approved, I will have no reservations being vaccinated. And I think that vaccinations, if you take a broad view of the history of vaccination, there's no single medical intervention that has saved more lives than vaccinations have. So I would have no hesitation to be vaccinated. I think that, any medical intervention can have a complication. Antibiotics have far higher risk on a per patient and per dose basis than a vaccine does. So I think you can feel very safe.
I'd like to concur with that. I think Dr. Gray and I have had the fortune of studying public health earlier in our careers. And probably vaccines have saved more lives than anything else other than hygiene out there. So I would highly encourage people to don't forget we're having trials, phase 1, 2, and 3, to assess the safety of these vaccines. And so far, the data that's coming out of Moderna as well as Pfizer, the two that have shown the most promise so far, the safety profile has been amazing. So I, for one, hope to get that vaccine when it becomes available.
And just to tag team all of that, we've never had the technological and just scientific understanding of how to make a good vaccine that we have now, even with the understanding of the genomic makeup of the virus itself. And that's really helped us to be able to come up with a vaccine much faster, which for some people makes them more cautious. But it's just that we are able to do that now, whereas in the past, we just didn't have that kind of technology. Is there a place we can go to or a number we can call for mental help during COVID? Shall we give everybody Dr. Gelbart's text, phone number?
There's a variety of things. There are, we're in a community with a large number of mental health practitioners. Your insurance plan, if you're covered with any insurance plan, will have a list of covered practitioners, and with proper insurance coverage, you don't have to pay outrageous fees. It's just a matter of a small copay. There are many low-fee clinics. That doesn't mean that they're not low value, but there are a number of clinics which are community clinics. There are helplines available, like Community Helpline in Palos Verdes has been there 40-plus years, where people can call in 24/7 and get someone that they can talk to. There's Beach Cities Health District has a mental health referral list, and it goes on and on. So we have a great number of resources in the community.
Is outdoor dining safe if people are eating and drinking without masks on?
I think that's a great question, which all of us ponder. I think it depends on where you are and where you're eating. As an example, most restaurants in LA County, and especially here in the South Bay, the few that are open for dining have arranged outdoor seating that's well situated apart from one another. That being said, recently tried to go to a restaurant with my family, and it was outdoor seating, but the outdoor seating was literally one table maybe a foot away from the other, and we made the decision not to eat there and just get takeout and go home. So I think you have to assess the particular restaurant available. Right now, I think that's tantamount to saving yourself from getting exposure.
I think that's absolutely right. The one other thing that I would say is that I would try not to think about these decisions in black and white terms. I don't think we're talking about safe versus unsafe. I think it's all about relative safety. And if you think about that list of risk factors that I showed regarding distancing, enclosure, masks, and so forth, the more of those features that are present in the negative, so closed space, enclosed space, so forth, the higher the risk something is going to be. But I don't think we can't talk about something that's perfectly safe, and you could do something very risky and still not get sick. So the other side of that calculation is how much is whatever you're proposing doing worth it to you? And you may have to make some decisions where it's worth it to take a little bit of additional risk in order to be able to do something that's very important to you. And then other things, even for a small risk, wouldn't be worth it. Everybody has to make those decisions for themselves.
I was just going to chime in exactly what Dr. Gray said and support that fully. Everything we do is basically a risk-reward formula, and we all have a right to make those choices as we wish. And for some dining out, it will be worth the risk, and for others, it may not. And as I said earlier, I think it's just important to honor your own beliefs and feelings, not judge others for what they do, and not allow others to judge or shame you for any behaviors you may have.
So I'd like to thank our panel tonight. I just, every time I go through one of these talks, I'm always so happy with what I've learned, and whenever we have more information, we just tend to do better. So I want to thank them for joining us tonight. This video will be saved on Facebook and our website at torranceMemorial.org/MOL. And as always, I always have to have the closing comment, and it kind of piggybacks on Dr. Gelbart. I found myself just getting really down in the dumps. And I don't know why, but I all of a sudden had the thought that someday down the road, we're all going to talk about 2020 and what we went through, and we'll all have our stories, just like we had for 911 and all of the other times in our lives. And for some reason, that made me feel better, and I think it tags on with Dr. Gelbart saying we're resilient. The other funny thing about that is 20 years from now, there'll be a whole generation of people who will have no idea what we went through. By that time, we'll understand COVID so well, it will just seem like polio is to us today. And so they'll probably be laughing at us that we were so scared. But it's just the role of mankind and human nature that we will go through it, we'll get through it, it'll be hard, but we'll get to the other side. So see you all on the other side.